come back to a lower dose with a maintenance dose that may be very effective. There's some studies going on with Abilify, but I think, again, this is all off-label, and this is what's being used. And as an adult, we have to think about the metabolic side effects, especially now that there's a lot of concern about obesity in children in our society. Now we're talking about medicines that may increase the risk of diabetes and weight gain. And again, after any trial of the medicines that we have mentioned, there's always the idea that you have to follow the progress or lack of progress, and at some point reassess the need for medication. Major depression. Again, I want to emphasize that even though we call it major depression, depression in children is usually rare. It's situational depression or depression from comorbid with something else. I think that whether we're talking about anxieties or learning disorders or ADHD even, that may be a lot more common, but when it comes to depression, it's rare that I really see a true major depression in a child. But when you do, these are the guidelines, and these are the guidelines that we would follow. As in any case, you would definitely have some therapeutic intervention and then move on to fluoxetine. The panel that convened a few months ago with the experts have agreed that because it's very difficult to justify now the use of any of the SSRIs except for fluoxetine, that would be part of the guidelines, but that Paxil and tricyclics are not recommended. Although, off-label, there are cases in which you may have an individual that has done well with Paxil because the family has done well with Paxil. But the focus is really on what the basics are for those individuals that are out there treating children and they may not have access to specialized psychiatric expertise. So really starting with fluoxetine first may be the way to go, and starting at a very low dose. The other good thing about fluoxetine is that it does come in a liquid. Bipolar or mixed mania in children and adolescents. There are some studies showing now that more and more that children that are diagnosed earlier with bipolar may not turn out to have bipolar as adults, yet there are studies showing that adults that are diagnosed bipolar and perhaps ADHD, looking back, may have had an ADHD diagnosis. But there certainly is a lot of kids that we don't know where they fit in, and they are being diagnosed bipolar. In fact, I brought this article. This is just from a couple of weeks ago, and it's in the media all the time. This is in the New York Times. They've done a series, but a couple of weeks ago they did a really fantastic article on the bipolar kid. And that refers to how in the 90s several books were written, one by a psychiatrist and then later by consumers, by parents, on the bipolar child. And I get a lot of times kids coming in with parents already saying, my son or my daughter has bipolar, and so you have to really go back and again look at the assessment and look at what's going on, because a lot of symptoms really overlap with other diagnoses. So it really makes it very, very, very difficult when already in the lay media the parents and online are getting a lot of information telling them that what their child has is bipolar. In the rare cases that you do have bipolar, this would be the guidelines to follow. Usually monotherapy. Again, the antipsychotics and mood stabilizers. And there is some thought that perhaps even some of the controversy over the antidepressants black label and the children that were becoming suicidal may be related to, there is some theories that they may be related to a diagnosis of bipolar or mixed state as opposed to true unipolar depression. That's it.